Can you hear me? Can you hear me? Hello everyone, welcome back to this session. My name is Nohayati Basri and I am psychology lecturer in Psyche College Sarawak. I will be your moderator for this session. Now I would like to introduce you the speaker for this webinar. Dr. Lau Kim Kah worked as a psychiatrist and as a deputy chairman in Mental Health Associations of Sarawak. Dr. Lau also a professional member of Malaysian Psychiatric Associations and National Specialist Register. For Dr. Lau, he has a lot of experiences in the mental health field. We are very lucky to have him here to share his knowledge on empowering mental health for prevention of suicide. It will be great if any of you have a question. Do not hesitate to drop your question to Dr. Lau after the session. Without further ado, I would like to welcome Dr. Lau Kim Kah. Over to you, Doctor.
Hello, good morning, everybody. I'm deeply honored and privileged to be able to give this talk on the webinar, to you all in conjunction with World Suicide Prevention Day. Yes, so I shall start the talk. Can I can't see my slide, is it? Oh, okay. Now I can see. So this talk will be okay, can we have the next slide? Or how do I control my own slide? Oh, okay. I'm going to divide this talk into three parts. Part one, I'll take you through by what we mean by having good mental health and how we can identify poor mental health. I shall also talk about how we can cultivate good mental health and also talk about this concept of global burden of disease and where does mental health stand in a global burden of diseases. In part two, I'll go into some of the common mental disorders that are associated with suicide. And lastly, in part three, I'll briefly talk about how we can all play our part working together to prevent suicide. Can we have the next one? Yes. So, yeah. So when we talk about health, most people think about physical health. However, health is more than just physical health, and it's more than just the mere absence of disease. Health is a state of complete physical, mental, and social well-being. Note that mental health is an integral part of the definition of health, and social well-being or social connectedness is also an inseparable component of health. So we have three components all together to contribute to health and well-being. According to the definition of WHO, can we have the next one? According to definition of WHO, mental health is defined as a state of well-being in which an individual realizes his or her own abilities and can cope with the normal stress of life, can work productively, and is able to make contributions to his or her own community. This definition indicates a balance between our own abilities, and our coping skills and the demands that life imposes on us. When stress and demands of life and our ability to cope are in balance, then we have good mental health. But when stress and the demands of life exceeds our ability to cope, then we will suffer distress and anxiety. And normally, healthy anxiety and stress can drive us to adapt and to seek a new balance. And thus, we can still achieve a new balance and maintain good mental health. But however, if the stress and demands overwhelms our ability to cope, then we may develop poor mental health, and that is where we may need to seek help. Can we have the next one? So mental health is more than just the absence of mental disorders. We all want to seek a balance of the various demands that is on us by our environment and within our own ability to cope. Somehow, some of the stress are well within our ability to control. That means certain stress we can control, we still we can manage. But if we take on too much, then it may become overwhelming. So the old saying that biting off too much, biting off more than we can chew is true. So we must know where our capability is, our coping ability is, and not to take on excessive amount of stress. Some stress are unexpected, and some stress are unpredictable. And the outcome is not within our ability to control. So such stress are more harmful and can test our ability to cope to our limits. And this sort of stress can affect everybody. We live in a changing world, so stress can come from any way and it can be unpredictable at times. We all differ in our own abilities to cope and our own vulnerabilities to stress. So if stress overwhelms us, we must then learn. We must all be able to learn and be humble enough to acknowledge that we are under stress and be willing to seek and accept help if needed too. So can we go to the next one? Now, everybody can have mental health regardless of whether we have or not have a mental disorder. This is just a reminder that having a mental disorder does not necessarily mean that we don't have good mental health. Mental ill health or mental disorder is a temporary state. When we are not well, if we seek treatment, we can regain our balance back and we can be restored back to health. And then we can still continue to cope and live with our disorder and at the same time continue to contribute meaningfully to our society. What is needed from us, from people with poor mental health, is acceptance from us and not to fear. Help and support is required of us instead of rejection and discrimination. And this way, people with mental disorder can still maintain social connectedness and maintain a sense of social well-being. So now, what constitutes good mental health? Being happy is, of course, a prerequisite for good mental health. As in the definition of what constitutes good mental health, you have to be a productive member, being able to cope and being able to adapt to a changing environment and being socially connected to our family, to friends, to our colleagues. And this sense of belonging, the sense of connectedness is very important to our well-being. Can we go to the next one? Now, the opposite of good mental health is poor mental health. Distress is part and parcel of facing stress, and it is a normal phenomenon in our life due to our ever-changing environment. But what we are talking about stress is that this stress doesn't overwhelm us, and the distress we feel is not persistent, it's not prolonged, and it's not severe. Normal stress causes some distress and anxiety, and this distress and anxiety normally will help drive us to adapt, to learn more skills, to help us grow and develop. But in the sense, through time, we develop more resilience to stress. But if this stress overwhelms us and we develop a mental disorder, then we are talking about distress and despair that is prolonged, that is persistent, and that leads to fears, anxiety, and sadness, and intrusive thought of worrying, negative thoughts. So if persistent, this negative cognition can then lead to a loss in productivity, lead to a loss in our self-esteem, and lead to a loss in our self-confidence. So poor mental health can often manifest as poor physical health, mimic the different types of physical disorders. Quite often they present as vague, somatic or bodily aches and pain. And there's actually a correlation between the number of body aches and pain that we experience and the possibility of an underlying depression or anxiety disorders. Suicidal thoughts is in the sense a manifestation of severe poor mental health, and it is a risk that we all have to face when we manage people with poor mental health. So next this is just a reminder that there is no health without mental health, and that mental health is an essential component of health. And then we should take care of our mental health as equally important as physical health. We all live in this rough world, dog-eat-dog world, and if we neglect our mental health, no amount of money later on is going to compensate for it once that is lost. So mental health care. When we talk about mental health care, we look into the various dimensions in mental health care. You need good physical health, and we need a balance between your exercise, diet, sleep, to have good physical health. You need good psychological health. You need to have a positive mental attitude. To have a good EQ, to be able to understand, appreciate, and empathize with other people, so that we can maintain connection with others. Good social connectedness is to be able to perceive support from other people, and at the same time to be able to support others. Lastly, we cannot forget spiritual health. It is an essential component of our well-being to have a belief in something. When we have good mental health, then we don't need to have drugs. We can be social without alcohol. We can feel a sense of belonging without having to smoke, and we don't need drugs to feel happy. Global burden of diseases is a concept. It is actually a tool that we use to quantify health loss. or loss of health. The most common measure that is used in global burden of disease is something we call disability adjusted life years, or in short form DALY, DALY. It is a measure of both the number of years of life lost due to death, due to a premature death, or the number of years lived with a disability. As infectious disease better and more controlled, epidemics are more well controlled, non-communicable diseases become more and more important, and the global burden of disease of non-communicable disease is rising in importance. However, with this COVID at the moment, it may reverse somewhat because COVID is a communicable disease. But overall, over the years, non-communicable disease is getting more and more important. Mental health and mental disorders come under non-communicable diseases. And over the years, again, there is a trend for mental health disorders to become more and more important. So if we look at the next slide, the next slide will look at the global burden of disease and where the various disorders rank. You'll find that mental disorders are now ranking higher. You have all mental disorders. We also have violence and self-harm, and as well as substance abuse and substance use. So you'll find that in all the different mental disorders, the ranking has risen over the years. And it's estimated that by year 2030, depression will become a leading cause for global burden of disease. So now we will look into how do we know we have good mental health. There are many tools in the internet and online that we can access to check on whether we have good mental health. We all feel distressed and anxious at one time or another. So this tool will help us decide whether the level of anxiety, the level of stress we feel are within normal limits, and whether if they are abnormal, then whether we need to seek further help and assessment. So one of the common tool is this DASS. DASS stands for Depression, Anxiety, Stress Scale. This is a shortened version, DASS-21. It is a self-rating scale, so we can all rate ourselves and then come up with a score that's divided into depression score, anxiety score, and stress score, and that will then tell us whether we are in a mild depression or mild anxiety or mildly stressed, or whether we are moderately stressed or depressed, or whether we are in severe category. If we score moderate or severe, we should then start to think about seeking professional help and professional assessment to confirm whether we actually have going into having a mental disorders like anxiety or depression. So now, once we find out that we are crossing the line over from good mental health to poor mental health, we need to seek help. So various types of help is available. Also, the type of help recommended also depends on the severity. Generally, for mild anxiety or depression or mild stress, counseling may be sufficient. Social support, talking to your family members, re-establishing your social connectedness, connect with friends, go out with friends, go with happy people, that may be sufficient to overcome mild anxiety or depression. But if it's moderate to severe, then you may need to seek more professional counseling, professional psychotherapy, or see a psychiatrist who will then give you some medication to treat underlying anxiety or depression. But of course, we don't forget about self-help, which is very important. Make sure you maintain good physical health, maintain a good work-life balance, make sure you get enough sleep, and stay with optimistic people, and try not to be in the company of pessimistic people too often. We can take up some exercise. We can learn relaxation exercise. The internet is a great resource for all the different relaxation exercise there is. The deep breathing exercise, the slow muscle relaxation exercise. You can learn or join yoga or learn Tai Chi, or meditation. So all these are self-help, which will also help come a good way to maintaining our mental health and balance. Okay, now we go to part 2. Part 2, I'm going to talk about the various the common mental disorders. It's impossible to cover all the different mental disorders because that will take days or years to cover. So I'm going to just very briefly talk about the more common ones. What we have to understand, what is a mental disorder? As with all cognitive process and emotion, these are all processes of the brain. So brain is a physical thing, a physical part of our body. So mental disorders is just as much a physical disorder as a mental disorder. So as Dr. Rose earlier on mentioned talk about neurotransmitters chemical imbalance in the brain, it just shows that mental disorder is similar, is also as much physical. The only difference between physical and mental disorder is that in mental disorder, we have yet to come up with an objective test to confirm our diagnosis. But if you look at over the years, over the years of the history of medication or history of medicine, you'll find that some mental disorders in the past are now considered physical disorders and are managed by physicians. So one of them is syphilis. In the good old days, it's called general paresis of the insane. But now we know it is it's caused by a syphilis spirochete. So yes. So the various mental disorders, the manifestation is quite often a disturbance in our thinking, in our mood and emotion, in our behavior. It's manifested as changes. So if a person has a lifelong way of thinking, if they have a lifelong anxiety, they are always more anxious than normal people. They are always more obsessional, more clean, and there's no change. It doesn't mean they have a mental disorder. It can be part of their personality. But so in mental disorders, we are looking for change. Change in the way they are thinking, a change in their mood and emotion, a change in their behavior. Then we are looking at a mental disorder. And quite often with this change, there is a change in the level of functioning, in the ability to work, in the ability to connect with friends and family. So they may become more withdrawn, more isolated. Their self-care may be poorer. So all these indicate an underlying mental disorder. Mental disorders, by definition, cause a lot of distress. Mental disorders is poorly understood in our society. And yeah, if you look at that in the next one, the next slide, it shows a lot of measures. This is started by a sufferer who felt that because of his mental disorder, she is being marginalized and discriminated against. And she came up with this badge, I have depression, and put it on social media to combat, we say, misunderstanding, to combat discrimination, and to try and promote inclusiveness. So she's trying to encourage everybody who have a mental disorder to stand up and be counted. It's not a shame to have a mental disorder. Mental disorders are very common. About 1 in 5 people will suffer depression in a lifetime. If you take all the different mental disorders, about 1 in 4 will finally need to see a mental health professional. So there's not a shame. And if you look at the for all this, I have depression at the bottom there, you'll find that there is this wording 1 in 5. 5 stigma, and you are not alone. That means if we are all able to own up to our mental disorder, to stand up and be counted, you'll find that it is very, very common. There's nothing to be ashamed of, and you are not alone. In depression, quite often because of this cognitive symptoms, they feel very alone, and our society doesn't help much by telling patients to you just need to pull yourself together, don't think too much. That actually make them feel more alone and more misunderstood. So mental disorders are very common. It doesn't discriminate between any race. It affects both sexes, affects both rich and poor, affect blacks and whites, and the yellows and the reds as well. So there's no discrimination between the disorder. Now, the common mental disorder, there are a lot of mental disorder, but the two most common ones are anxiety disorders and depression and depressive disorders. The word depression is used to be a medical term until the layman misused the term. We used to talk about when we are unhappy, we used to talk about feeling blue, we used to talk about feeling low, feeling sad. But nowadays, people use the word depression all over the place. So now, mental health professional, instead of using the term depression, we use the term major depression. Both these two conditions are highly prevalent, as I mentioned before. It affects about 1 in 5. If you combine with all the disorders, it affects about 1 in 4. It impacts. Its impact is mainly on the mood and feelings and the ability to function. If you look at our local statistics, our Malaysian Ministry of Health conduct National Health and Morbidity Study once in a few years. If you look at the statistics in 2015, mental health problems is found in about 29.2% of adults, and in children, it is as high as 25%. It's as high as 15%, so about 1 in 6 of children. So it is very prevalent, and yet we don't talk about it. Okay, now we go into the specific mental disorders. We talk about mood disorder first. Mood disorders, there's mainly two types. One is the depressive disorder, and another one is a bipolar mood disorder. And mood disorders are characterized by abnormal fluctuation in the mood. In major depression, the depression is abnormal in terms of its persistence, in terms of its duration, in terms of its depth, intensity, and the severity of the distress it causes, and the impairment it causes to the ability to function in the sufferer. Psychologically, a depressed person has an inability to feel positive emotion. They can't feel pleasure, they have loss of interest. There's also loss of self-esteem, a loss of sense of self-capability, and they often have a lot of negative thoughts. And these negative thoughts are automatic and intrusive. So don't tell a depressed person don't think about it, because they don't want to think about it. It's just the brain continues to think about it automatically. Because of all these worrying thoughts, they often have difficulty to focus and concentrate. They become a bit forgetful, and all this affect their ability to function. Suicide ideations are very common in depressed people. It's seen in about 90% of people with depression. Some people say that if you talk about suicide, you may put the idea in the person who has depression. But don't worry, it's already there. About 90% of people with depression have suicidal thoughts and ideation. So it's important to talk about it. In bipolar disorder, again, this is a mood disorder characterized by the abnormal fluctuation. One day you are high, it may stay high for a period of time, and it may be followed by a period of normality, and then suddenly you go low. When the mood is low, there's no signs and symptoms wise is exactly the same as a major depressive disorder. But when they are high, they may feel very happy, overly happy, abnormally happy. Or some people, instead of feeling happy, they are very irritable and angry, especially when people try to stop them from doing what they want to do. They can actually become aggressive, they become impulsive, they are overconfident, they are over sociable, and they'll stick their nose into everything that other people do without being invited. So that is bipolar mood disorder. Now we go into anxiety disorders. I hope I'm not going too fast. Anxiety disorders is again characterized by abnormally high level of anxiety and worries. They are again persistent, causes a lot of distress, and affect the ability of a person who suffer from anxiety to carry out their normal activities. For example, in social phobia, the sufferer has a fear of meeting people. This is to distinguish between people who normally are introvert, who don't make friends easily, but they feel happy with themselves, and they feel happy with a small group of friends, so they don't have social phobia. So those with social phobia are fairly normal until they develop this disorders, or there's this change that they perceive, that they now they have become fearful of meeting strangers. They worry about being judged by other people, and because of that, then they avoid meeting people, going out. You have panic disorders. So panic disorder, a sufferer can experience a sudden, unpredictable, severe attack of panic, during which they often fear, there's intense fear of a catastrophic event, that they may faint, they may be having a heart attack, or having a stroke, or they can't breathe and they feel that they are going to die. They feel that they are going to lose control, and they fear that they may be going mad or something like this. And panic disorder can be associated with suicide. They may not be depressed, but because it's so distressing, in an attempt to try and escape from this tension, they may actually commit suicide unintentionally. In obsessive compulsive disorder, the sufferer suffers from a persistent doubt. This doubt can be related, for example, related to cleanliness, or a doubt related to safety. A doubt related to cleanliness may cause the sufferer to perform ritualistic type of cleansing, washing hands, taking a long bath, or fear of safety may cause the sufferer to repeatedly check the doors, whether the doors are locked or not, to check it repeatedly, and to check whether the gas has been turned off or not. So there are many different types of doubts and rituals that they do. So complications of untreated anxiety is that they may develop depression, they may develop other mental disorders like generalized anxiety disorder later on. They may self-medicate, they may turn to alcohol and other substances. They may have insomnia, they may have a lot of chronic aches and pain, they may digestive bowel. Quite often we see patients who have been to a gastroenterologist, who have been to a cardiologist, who have been to a neurologist or to ENT specialist, and finally they are told that there's nothing wrong with them and they need to see a psychiatrist. Okay, we go to psychotic disorders. The next slide. Can we have the next one? Or psychotic disorders. The most severe mental disorder is schizophrenia. This is a very chronic and severe disorder, and it affects about 1% of the population. And both male and females are equally affected. The signs and symptoms are quite often we divide it into what we call positive symptoms and negative symptoms. Positive symptoms are abnormal by nature of its presence. That means a normal person don't have these symptoms, but when they have psychosis, they do have these symptoms. So this may be hallucinations. That means they can hear things that that's not there, or they can see things that it is not there in the first place. So they may have delusions. Delusions are usually false beliefs, which the person hold with conviction, and there's no point trying to argue with him that his beliefs are not true. So for people like who have hallucination, they may hear voices, and these voices generally are of people They can be one voice, they can be multiple voices. They are quite often from unfamiliar people, but there are occasionally people who hear voices from familiar people. These voices can give them commands, and some of these command hallucination can have what we call an imperative quality. It's very difficult for the sufferer to refuse. And because of some of these commands, some of these sufferer end up committing suicide or even homicide. So it's very important to be aware if somebody is behaving abnormally, whether he has a psychotic disorder or not. As I mentioned, these are positive symptoms. There's another group of symptoms, we call it negative symptoms. Negative symptoms leads to a loss of interest, loss of drive, loss of motivation, and this can manifest in inability to work, lack of interest. So for students, they will then have difficulties in their studies, and if not treated, both these positive and negative symptoms can be very disabling. Our National Schizophrenia Registry in Malaysia indicate that quite a lot of people with schizophrenia are untreated, and the delay in obtaining treatment can be as much as 15 years. And if you have a psychotic disorder for that long of time, they would have accumulated a lot of handicaps and disability. They would have faced a lot of social rejection. So it's important that people with psychotic disorder to be treated as early as they can. People with schizophrenia, generally those who stay outside the mental hospital, they generally have a lower life expectancy. They tend to suffer more illnesses, and there's a higher chance of dying at any age. And with all mental disorders, treatment is highly effective. It's actually more effective than some other medical conditions. Okay, the next slide. Substance use disorder. We all live in a very stressful world, and sometimes once in a while we want to escape the reality. And some people abuse drugs for this reason. Some of these substances can be legal, like alcohol, caffeine, tobacco, tea and coffee. We take them for granted, and we don't think that they are substance of abuse. You do hear of people who just cannot start the day without a cup of coffee. So it does indicate that these people may actually be dependent. And if they don't drink their cup of coffee, they just cannot function for the rest of the day. Same with a person who has developed alcohol dependence. He must have his alcohol in the morning, without which he just cannot go to work. But some are illegal, and being illegal means that they are highly addictive. They can be very destructive to a person. They have a lot of complications if not stopped. But that doesn't mean that the legal ones are safer. Don't get me wrong there. The legal ones can be just as addictive. In fact, if you look at the potency for addiction, nicotine ranks very, very high. And tobacco actually cause a lot of disability and cause a lot of, it is very costly to treat the complication, especially like lung diseases and cancer of the lung. A lot of disorders can occur, so you can get intoxication, you can develop mood disorders. A lot of people who drink alcohol tells you that they drink alcohol because of that they develop that they drink alcohol because they are unhappy, they drink alcohol because they are anxious. Don't believe too much in that. A lot of people develop depression and anxiety directly due to the toxic effect of alcohol. So if they can reduce the alcohol use over a period of time, their mood actually becomes better. A person with bipolar mood disorder, if they can reduce their use of alcohol, their mood can actually become more stable. Certain drugs can produce psychosis, especially marijuana. Some drugs over a long period of use can develop dementia, for example, alcohol. So these legal drugs are not entirely free of complications, and they are not exactly risk-free. Yeah, so we go to the next one, suicide and mental disorder. Can we have the next slide? Yes. Oh, we have overshot. Yeah, it's common to believe that suicide indicates an underlying mental disorder. After all, a person who
Hello.
commits suicide.
Hi, Dr. Lau.
Yeah.
I'm sorry to interrupt. Because we have received a lot of questions regarding the part 1 and part 2, maybe we should go for the questions first, Doctor?
Okay.
Okay, thank you, Doctor.
Okay.
And there's one question from Norcia Birdie. She asking about, is mental disorder genetically related?
All disorders have some genetic component, so it can be inherited. For example, schizophrenia, we say in the population you see about 1%. But if a person with schizophrenia marries another person who is not a schizophrenia, the chances of the offspring getting it is about 16%. So there's a 16% increase in incidence. But if you look at like depression, depression is already very common in the community. It's already about close to about 20%. So in this type of disorder, then we generally don't talk about genetic inheritance because it's already so common. So genetic inheritance is less important in a very common disorder. But yes, they can all be inherited.
Oh, okay. Next question is, so why mental disorders are so common nowadays, Doctor? What do you think?
Yeah, it's getting more common, especially those we perceive to be related to stress, the anxiety disorders, the depression is getting more common. The psychotic disorder has been fairly stable through the years. Not only mental disorders are getting more common, they are getting younger. Depression is affecting more and more younger people nowadays. It's probably related to the stress. We tend to be more disconnected nowadays. We don't live in big extended families anymore. We live with nuclear families. We are very mobile, so we don't keep in touch. Although you say, well, we have social media, we have WhatsApp, we have Instagram, we have WeChat, we have Facebook, we are connected to so many people. But that actually is a double-edged sword, because a lot of studies shows social media use, heavy social media use is related to an increase in mental disorder. It is multifactorial. It may be related to our upbringing. Nowadays, we are all told to not to scold the children, not to hit them, to praise them. For every little success, we say, good boy, good girl, we are very good, we are very smart. But that be so when they grow up in the working adult world, you don't get praised so often, you get put down quite often, and you never learn the skill to how to handle these negative sort of comments, and you get more stressed out. So it may be related to how we bring up our children nowadays. So yeah, it's a lot of.
I see. Okay, the next question, doctor. How we can differentiate between worry and anxiety disorder?
Yeah,
This question from Lee Mei Fen.
in normal worries, a normal person who is healthy, who face some challenges, some problems, we do worry. Worry is normal. Feeling anxious is normal. But for a healthy person, we can control those worries. If we go to sleep and the worry in thoughts coming, we can say, we don't have to worry tonight. We can worry about it tomorrow. Put it aside first. We look into priorities. But with anxiety disorder, these worrying thoughts become intrusive. We can't control them anymore. It seems to have a life of its own. It keeps coming. You say, no, I don't want to think about it. You still have it. Because of that, it affects your sleep. Because of it, worry, you can't concentrate. You want to read something, but your mind is somewhere else. So it affects your thinking, affects your work, affects your functioning. So basically, is the differentiation is one is it causes a lot of distress, and this distress is abnormal. Then we call it an disorder. In anxiety, it causes us distress. For example, a student facing an exam or a test, they are all distressed and anxious. But we can handle that and we cope with that. We decide to study more, spend more time, organize our study, you see. But when you have an anxiety disorder, it becomes excessive, too much, overwhelming, and we just don't know how to cope with it anymore. And then we can't. And so we have our studies ends up.
All right, agree. And then next questions from Miss Kiaji. From your experience, how long does it take for patients to recover from mental disorders? And is there any disorders that are incurable?
Well, all mental disorders are treatable, and if treated adequately, treated early, most people will recover. For anxiety disorders, almost everybody will recover. For depression recovery, we say it's in the range of about 60 to 70%. So these are all highly treatable conditions. You don't need to take medication for life in most mental disorders. Treatment is for a cause. Like depression, you may need treatment for about 9 months to a year. Panic disorder, generally around 9 months. So that you don't need to be permanently on medication, so to say. But are they curable? It depends on what you mean by cure. If you mean cure means after treated, the illness will never come back again, then no, there's no cure. It means after treated, you recover. We stop the medication, you stay well, but sometime, somewhere in future, it will come back again if you face some stress again, stress that's overwhelming again. So yes, it will still come back, and then you still need to restart your treatment again.
I see. That's why maintaining the stress level of stress is very important.
Yes. So you go for treatment. After treatment, when you become well, you have to look into your lifestyle. You have to look into self-help, your diet. For example, in depression, we say diet is important because now we do see as depression may be related to our gut health. So diet becomes important. There is a treatment, a diet we call modified Mediterranean diet for depression that you can Google up as well.
All right. Thank you, Doctor, for answering all the questions. Now we move to the third part, which is suicide and mental disorder. We continue.
Okay, thank you. Some of this actually has been covered by Dr. Rose. Yeah, like we say, not everybody who have died by suicide are mentally ill. That is a very common misperception. Although we say depressive mood is seen in about 90% of people who commit suicide, this doesn't necessarily mean that they have a mental illness. Suicide is multifactorial. It's a very personal choice, and we never know why a person takes his or her own life. We know the risk factors, but we'll never know what is the ultimate trigger. Why did that person decide to take his life on that particular day at that particular place? So it is a very personal decision. But not all are mentally ill. If you look at requests all over in some countries for assisted suicide, so these people wants to die rationally. They may be suffering from an incurable illness. For example, Alzheimer's disorder. They know what is the end stage of Alzheimer's disease, and they don't want to be a future burden on their children. They don't want the quality, they don't want to live in that type of quality of life. So some may be rational type of suicide. So suicide is very complex and it's very multifactorial. It's not as easy to see. Yeah. So we go to the next one. Next slide is about social media, as I mentioned a bit earlier. Social media use is rising rapidly, and the group that uses it most heavily are the teenagers and the young adults, and especially the teens, the 13 to the 17 years, are the ones that are most heavy users of social media. And a lot of them not only spend a lot of time on social media, but they also have a lot of accounts. They have Facebook, they have WeChat, they have Twitter, they have Instagram, WhatsApp. They have a lot of accounts. And it has been shown in a lot of studies that time spent on social media correlates with depression, anxiety, poor self-esteem, fatigue, and the fear of missing out. A fear of missing out is abbreviated as FOMO. A lot of studies now suggest that we should restrict our social media time to 30 minutes a day. If you have 3 different accounts, it means that you they need to restrict to 10 minutes per account. The total duration should be about 30 minutes a day. Otherwise, there's a risk that you may develop the depression or anxiety disorders. Gaming is another area that is now becoming more of a concern. A lot of games that we play now are highly addictive style games, and the designers of these games knows how to design them to be addictive. But design it in different multiple levels that give you rewards. Rewards are not predictable, so sometimes you get it, sometimes you don't get it. So this intermittent reinforcement is the reason why games now are so addictive. And game addiction is associated with suicidality, perceived burdensomeness, and poor belongingness. Now, what do you mean by perceived burdensomeness? Perceived burdensomeness is how the gamer see themselves as a burden to his social group, to his peers, and to his society. And poor belongingness indicates our social connectedness. So those who play a lot of games tend to see themselves a burden to their peers, to their family, and they tend to be less connected to their social group. Although, as I said earlier on, when you have a lot of connections on social media, it doesn't mean that you have connectedness. And these two concepts, perceived burdensomeness and poor belongingness, is directly associated with suicidal ideation and wish to be dead. Now, there's a lot of questions why some gamers who are addicted commit suicide. That brings us to the another concept. It's called acquired capability. To commit suicide, to have suicidal ideation doesn't equate to a risk of killing yourself. To kill yourself, you need to overcome the fear of pain and a fear of dying. And that's where acquired capability comes in. Games that are more popular now are fairly violent games. And violent games tend to expose the gamer to death. You see a lot of pain on the game. And over a period of time, you become desensitized to pain and desensitized to death. So with this loss of fear of pain and loss of fear of dying, combined with this suicidal ideation, then it leads to suicide. The picture that I show at the bottom of that slide is a game we call Person Unknown Battleground, PUBG. These are multiplayer games which is online and can accommodate up to 100 players at a time. And in the game, they are all flown to an isolated island or something like this, drop on the island, and you have to kill each other to survive. The person who survive at the end is considered the winner. The 99 other people are losers. So in the process of becoming a winner, you kill everybody. So you see so much death and you see so much pain. So after a while, you become desensitized to it. So that's where this three concepts, perceived burdensomeness, how they see themselves as a burden, poor belongingness, their disconnect with social group and society, and this acquired capability leads to increase in the suicide. So next we go into helping people with suicide ideation, suicide survivors, family, friends, people who died by suicide. This will be the part 3. For those who like short form, you have K, K for catch the warning signs, attentively listen, risk management, and ensure professional help. So make it easy for students to remember. But basically, I think Dr. Rose may have covered quite a bit of it. You see the 3 buttons there, I put there. Helping people, one is you must know the signs. Know the signs and symptoms which Dr. Rose has covered. Find the right words. It's important to use the right words, to use the right message, to speak the right things, to say the right things. Otherwise, it may make the matter worse. And we must be the bridge or the link. So there's a number of do's and don'ts, which I think Dr. Rose has covered quite a bit. You must show your genuine concern, listen, to be able to help a depressed but a suicidal person. The most important skill we need to acquire is listen, and don't talk so much. Don't probe. If they talk about that they are feeling depressed because of family problems, don't dig out too much about the family problems. You don't need to know that. You just encourage them to speak, feedback to them that you've understood what they have spoken, give them a lot of time to talk. And if they tell you they are depressed and they feel life is worthless, then you can use what they have said to ask about, have they thought about that life is not worth living? Do they wish to be dead? And then ask them whether they've thought about harming themselves or whether there's suicidal ideation. So we should ask about suicidality, assess the risk of suicide in everybody who is depressed. Quite often, the depressed person who tells you about suicide will tell you to keep it a secret, don't tell anybody. And that's the worst thing you can do to help. We should tell somebody who we think is in an authority to help. For example, a teenager in school tells another friend that he is thinking of dying, of committing suicide. Don't keep quiet. Maybe you should tell the teacher, who can then, or tell the school counselor, who can then connect the suicidal friend, who can call him up, call up the family, rally up the support for that person. Don't offer advice too early. Don't be too judgmental and provoke too much guilt. and don't belittle their distress. Don't say I understand. We don't actually understand. We will never understand fully their suffering. And never say everything will be okay, because it is not okay. So we have to be the link, stay with the person who you think is suicidal. Don't leave him alone. Be the bridge. If you don't dare to leave him, you can say, I can help you. I can make arrangement for you to see a mental health professional. And if they are not keen to see somebody in person, you can be the link to say that I can take you to make a phone call, to befriend us, and stay with the person as you make the phone call. The next one is helping suicide survivors. We tend to forget about the survivors. Suicide survivors doesn't mean we don't refer to the person who attempts suicide and survive. We refer to the people who are left behind by people who have killed themselves. Their friends, their family, their colleagues, and their health professionals. Quite often, the survivors face very intense guilt, intense grief. They have a lot of questions unanswered. Is it because of them? Is there something else they could have done? They would have a different outcome. So similarly, like dealing with a person who is suicidal, be a friend. Listen without judging. Don't say, oh, you didn't realize, you didn't see it coming. That is not, that is a bit judgmental. Accept the intensity of the grief, and don't offer thoughtless comments like, oh, it is so sudden, it's so unexpected. That does not help. If you think that they need help, put them to be the link again, to seek professional help. If you know of somebody who is a survivor of suicide, you can put them in touch with the survivor, provided the survivor gives you permission. And of course, be vigilant about suicide. A suicide survivor is at increased risk of suicide. He may have witnessed the death. As I said, there's this acquired capability. So if he has witnessed the death, his fear of death is actually reduced. So that's, I think, about the end of my talk. The next few slides, this one is advertisement for us. We are from Mental Health Association. We do provide counseling services, but at this new norm at the moment, we provide online counseling. We do a lot of community mental health literacy. Among them is a Mind Brew program. It is an outreach program. We try to reach to youth to promote the mental health and emotional well-being. And the last slide is where you can find us. We are at Jalan Kereta Api. You are welcome to drop by. So I think that's about all. Thank you very much. Stay safe.
Thank you, Dr. Lau Kim Kah, for the inspiring and wonderful thought of empowering mental health to prevent suicide. And I would like to conclude what Dr. Lau have shared to us today. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Over the course of our life, we have experienced the mental health problems, right? Either it is the low level of mental health or high level or the severe level, and our thinking, mood, and behavior could be affected, and this will lead to suicide. Therefore, by empowering our mental health will help us to determine how we can handle the stress and relate to the others and make a choice. If just now Dr. Rose shared about the talk, the acronym of talk, Dr. Lau have shared us about CARE, which is meaning that CARE stands for catching the warning sign, respect, and also give space. Sorry, Dr. Lau. Catch the warning sign, attentively listen, risk management, and also ensure for the professional help. And we received another 1 or 2 questions, Dr. Lau, before we end the session.
Okay.
This question coming from Miss Yi. Do we need to seek consent of the person in distress before introducing authorities for help?
We in the sense we as a bridge for help, we have to ask for consent. That means we stay with the patient, we stay with the person at risk, and we reassure them that we are there to help them, and we can be that bridge to their help, that we can help to arrange professional help. Let's say I know so and so who is a counselor, and who can help you. Or if the person doesn't want to see the person face to face, you can say, oh, I know a telephone number of the vendors which you can call up. In the sense that you have the consent of the person. Once he agrees, then you should try and stay with the person for the first time, take him to the counselor, or for the first time, stay with him while he makes the first phone call to the defenders. But you have to respect in the sense there are some people who will refuse any consent, and who refuse any help. And that's where sometimes we have to accept our limitation. But for small children in school, if a teenager tells another teenager that he's being bullied, that he feels that life is not worth living, then you don't really need the consent. Don't sway yourself to secrecy. Go and tell somebody who's in a position to help that child, the teacher, or the school counselor.
All right. Thank you for sharing all the knowledge, Dr. Lau. And this is the end of our session. For all the viewers, please do not forget to get your e-certificate. We will share the code after this, and register yourself to the form that we provide lah. So sorry, we're waiting for the code, Dr. Lau. Thank you, Dr. Lau.
Okay, thank you.
Or
Thank you, everybody.
thank you. Or maybe can access the cert by clicking the link below. We have shared the link, and do not forget to get the cert. And what important is practice whatever that Dr. Lau have shared to us, so that we can help our community. Helping each other is better. And do not. Do help all the and take care all the signs and of our friends and family, and also all the communities. So thank you, Dr. Lau. Thank you everyone for watching, and stay tuned for our next sessions, which is Let's Talk.
Bye.
Goodbye, Dr. Lau.